All right, welcome everyone. Thank you so much for joining us today for our public health talk on the coronavirus. My name is Nicole Duffy. I'm the Director of Major Gifts here at the Fund for Public Health in New York City. And before I get started, I just want to share a couple technical things. If you'd like to ask a question at any point during this webinar, you can type your question into the chat console or the Q&A feature, and we're going to do our best to get to as many questions as possible once our speaker is done with their presentation. Also note that this webinar will be recorded and we're going to send a copy to you afterwards. And if you experience any technical difficulties during the call, you can let us know by emailing us at info@fphnyc.org. So without further ado, I'm going to pass it on to Sarah Gardner, who is our Executive Director here, and she's going to get us started.
Hi, everyone. Welcome to Public Health Talks with the Fund for Public Health in New York City. As Nicole said, my name is Sarah Gardner, and I've had the privilege of being the Executive Director here at the Fund since 2008. For those of you who aren't so familiar with us, we're an independent nonprofit that works in close partnership with the New York City Department of Health to improve the health and wellness of millions of New Yorkers. How we do this is by creating partnerships and securing funding to test out new ideas and launch innovative public health initiatives to keep all New Yorkers healthy. We've designed these calls so people like you, public health supporters, can learn more about the urgent health issues that are facing New York City and hear about the incredible work being done, often behind the scenes with little fanfare on behalf of millions of New Yorkers. I'm excited today to introduce our special guest, Prachee Patel. Prachee's from the New York City Department of Health and Mental Hygiene. She works in the Office of Emergency Preparedness and Response. Her job, alongside many other experts, is to help the city prepare for and respond to public health emergencies like the coronavirus. Prachee, thanks so much for being here today. We're grateful to have you here to share your knowledge and expertise with all of us. I know we've all been following the headlines regarding the rise and spread of the coronavirus, and I also know that it can be really challenging to parse out the facts from the sensationalist headlines. There's lots of confusing information out there. Prachee today is going to help us sort through the facts and provide us some insight on what's happening at the health department in response. So again, without further ado, I'm going to hand it over to Prachee.
Hi, thank you, Sarah, and thank you, Nicole, and welcome everyone to the webinar. I do want to thank the Fund for Public Health for inviting me to do this talk. I think it's really relevant and poignant to everything that's going on right now. And so I'm the Director of Grants Management here in the Office of Emergency Preparedness and Response. And the reason I mention my day-to-day title is also to just point out that even if someone's day job is doing something like grants management, we are part of the emergency response here at DOHMH. I want to do a quick disclaimer. The situation, as you've seen in the news, is rapidly changing, as is our understanding of the 2019 novel coronavirus. So all of the information I'm presenting today is based on our best knowledge as of today, February 19th, 2020. In terms of the walkthrough of the agenda, we're going to do a quick overview of the novel coronavirus. I'll give you a snapshot of what's happening globally and domestically in the U.S. and what's happening in New York City. We'll talk a little bit about protecting our communities and how you can help, and we'll also go through some resources of where you can find more up-to-date information. So what are coronaviruses? It's a large family of viruses that cause illness ranging from the common cold to more severe diseases like pneumonia. So many coronaviruses only infect animals and are not transmitted to humans. However, some coronaviruses cause illness only in people. And coronaviruses are rarely zoonotic, meaning they can be transmitted from animals to people. So a novel coronavirus is a type of coronavirus that has not been previously found in humans, which is what we're seeing here with 2019 novel coronavirus. A little bit about outbreaks we've had in the past of zoonotic coronaviruses. For those of you that were around, SARS-CoV, those cases were first identified in 2003. There were over 8,000 cases globally, and it started in China, identified in civet cats, and there have been no new cases since 2004. Another example is the MERS-CoV outbreak, where we saw first cases in 2012, and there's been over 2,400 cases globally. This outbreak started in Saudi Arabia from dromedary camels and actually continues to infect humans. The 2019 novel coronavirus, we saw first cases in late 2019, and we have not yet identified the source in terms of the animal that, how it was transmitted to humans. So what is 2019 novel coronavirus? So the outbreak of this respiratory disease centered in Wuhan, China, which is in Hubei province. It was identified in December of 2019 and originated in animals and infected humans who came in contact at a live animal market in Wuhan. Testing by Chinese scientists revealed that we were dealing with a novel coronavirus. What are the symptoms and treatment? In terms of symptoms, they can range from asymptomatic, meaning there are no symptoms, to mild to severely ill, and can include fever, cough, and shortness of breath. The incubation period, or the time from exposure to when someone gets sick, is estimated to be 2 to 14 days after that exposure. And in severe cases, the infection can cause pneumonia and other respiratory issues, potentially kidney failure, and also death. And you should know that there are no vaccines or treatment currently available for the 2019 novel coronavirus. And how is this virus transmitted? We don't fully know yet how the virus spreads. It can be transmitted from one person to another and potentially can spread even without symptoms. People with symptoms are, however, thought to be the most important driver of this outbreak. Other respiratory viruses spread through coughing or sneezing, close personal contact such as touching or shaking hands, or touching an object or surface with the virus on it, then touching your mouth, nose, or eyes before washing your hands. In terms of global cases, there's been over 74,000 cases and over 2,000 deaths, mostly in older adults and people with underlying health conditions. And there have been thousands of people hospitalized. In terms of U.S. cases, we currently have 29 cases, 2 of which were infected in the U.S., where the person who got sick was in close contact with an infected person. And so far, there have been 0 cases in New York State or New York City. We've had 7 suspected cases, and they've been tested in New York City, and all have tested negative for the novel coronavirus. And 16 out of 17 of the suspected cases in the rest of New York City are negative also to date. In terms of the global response, the World Health Organization, or the WHO, declared 2019 novel coronavirus a public health emergency of international concern. WHO international team of experts was also sent to China to help with the outbreak. In China, they've been doing screening and quarantine of potentially exposed people. They've had transportation restrictions and bans in many cities, and they've been rapidly building hospitals and setting up quarantine facilities. In addition, many countries have travel and flight restrictions and have also limited the entry of people who have been in China. In the U.S., a novel corona task force was created to lead the U.S. response, and the Centers for Disease Control and Prevention, the CDC, rapidly developed a diagnostic test and is building capacity to test nationwide. State Department also issued a level 4 or red travel warning, which is states do not travel to China. Many airlines have also suspended all flights to and from China, and flights from China can only arrive at 11 U.S. airports, including JFK and Newark, which is close to New York City, of course. Foreign nationals who visited China in the past 14 days may not enter the U.S. The exception for this is lawful permanent residents, or green card holders, an immediate family of U.S. citizens, and lawful permanent residents. For people permitted to enter the U.S., if they were in the Hubei province, which again is where the outbreak originated, in the past 14 days, medical screening and mandatory quarantine for 14 days since their last day in Hubei province is required. If they were in another part of China in the last 14 days, medical screening and home self-monitoring for 14 days since their last day in China is what we're working with. And those people are asked not to go to work or school and limit, public gatherings and that sort of thing. In terms of New York City's plan, our response is focused on identifying people who may have been exposed to the virus, investigating and monitoring potential cases, and informing and engaging healthcare providers, community partners, and the public about the virus and prevention and response efforts. Our New York City response includes enhanced surveillance to identify possible cases, implement federal monitoring requirements, educating the public, providing guidance to healthcare providers, and laboratory testing at New York City Department Public Health Laboratory. So this picture that you see here is our Department Emergency Operations Center, also known as our DEOC. That's our central location for where our response leadership and staff can come together to facilitate close communication and coordination. There's hundreds of staff at the health department working on the response currently, and this is where we have our daily meetings regarding our response. I wanted to give some context to New York City and the risks that we face. Just given our population density, the amount of tourists we have, the number of commuters we have from surrounding counties, the percent of our population that's under 18 years, the percent of our population that's over 65, foreign born, the vast number of languages spoken, just the diversity of New York City makes emergency response challenging for us. And there's also, we are a regional transportation hub, we're an international transportation hub. There's a lot of, icons and landmarks and a lot of planned events that happen in New York City. All of these things make New York City high risk for incidents, whether it's terrorism related or it's a disease outbreak. A disease would spread really quickly just given our population density, or even if it was a natural disaster. If there's flooding, for example, a lot of people would be impacted just due to the population and the shape of New York City. And any and all emergencies have a public health impact. When we are responding to emergencies, it requires close coordination and communication with the federal, state, and city government levels, as well as other sectors. And GOHMH has an all-hazards approach. That means we are always planning for any kind of emergency that could happen, whether it's chemical in nature, biological, radiation, nuclear explosions, natural disasters. And we really feel that all response is local. We really want to make sure the health department and our sister city agencies are best prepared and poised and equipped to respond to really anything that could happen in this city. In New York City, the health department is responsible for health-specific things that other agencies can't do, and that includes disease surveillance and epidemiology, public health orders, clinical guidance and risk communication, mass prophylaxis and vaccination, laboratory testing for biological and radiological, public health assessment, environmental mitigation for both radiological and biological, animal-related surveillance and vector control, and mental health needs assessment and service coordination. Those are the things that the rest of the city is looking to the health department to do during an emergency response. There have been many emergency responses in the last 20 years. Some examples are the attacks on the World Trade Center, anthrax letters in 2001, there was a Northeast blackout in 2003, there was H1N1 flu in 2009, Hurricane Irene in 2011, followed by Superstorm Sandy in 2012. We had the Ebola response in 2014 to 2015. We had a large outbreak of Legionella disease in 2015. We had the Zika virus outbreak in 2016. We had a large measles outbreak in 2019. And now in 2020, we're poised for a novel coronavirus. Whenever we need to respond to an emergency, the health department uses something called the Incident Command System, or ICS. ICS is a standardized organizational structure used nationally by first response agencies in situations where the existing organizational structure becomes overwhelmed, i.e. during emergencies. The ICS delineates roles by title and experience, not day-to-day responsibilities, so this means that staff may have a different assignment and supervisor during an emergency. And it provides management tools to efficiently organize staff into clearly defined roles. It also facilitates clear communication by eliminating radio codes, slang, and jargon, and ensures the safety of staff. It also leverages the agency's resources more effectively, and it's scalable to meet the needs of any emergency. All GOHMH employees have a response role during emergencies when ICS is activated, and response groups can mobilize staff per their skills and experience to support any of these activities. So I mentioned earlier, my day-to-day job is grants management, but as part of a response, I can get pulled in to work with a completely different supervisor, completely different group, working on totally different activities that support an emergency response. The flip side of an emergency response is called continuity of operations, and this ensures the ability of our agency to continue our essential services during a wide range of emergencies. So while the majority of the agency may be responding to an emergency, there are certain things the health department has to do and cannot stop doing to provide services to residents of New York City. And some examples include death and birth certificate issuance, so vital records, our public health laboratory, and our poison control center. That's a quick overview of some things just more specifically about what the agency is doing related to the New York City response to coronavirus. And I hope that gives you a little more insight into what's happening inside the health department, as I know you've been hearing a lot of these other things in the news. So I just want to remind everyone that currently the risk to New Yorkers is still low, but we recognize that uncertainty is scary. And we know New York City has experienced an outbreak response, and we're working hard to stop any potential spread of novel coronavirus. Just a reminder, if you are sick, it is much more likely to be a cold or the flu. So a little bit about protecting our communities and how you can help. Most important is stay informed. We want to make sure there's not misinformation and myths and just not true information being spread. So we want to make sure everyone is checking the New York City Health Department and CDC web pages, which are frequently updated. And we ask that everyone rely on and share only information from these and other trusted sources. Really important is to prevent stigma and discrimination. We want to separate facts from fear and guard against stigma. A lot of information in social media and the news is not based in science or on facts and is offensive, demeaning, and racist. And misinformation and rumors can cause fear, bullying, and derogatory comments, and unfounded exclusions from work and school. Just want to point out that the New York City Commission on Human Rights is here to help people who experience discrimination. They investigate claims and can impose fines and compensate people for any harm. And here is the New York City Commission on Human Rights. Anyone can call 311 and say human rights to be connected. So what can people do to protect themselves from novel coronavirus? So folks should go about their daily life and practice good hygiene that prevents many types of infection. So that includes getting the flu vaccine to protect against the flu. It's not too late in the season for that. Washing hands often with soap and water and using alcohol-based sanitizer. Not touching your face with unwashed hands. Avoiding close contact with people who are sick. And going to the doctor and otherwise staying home when sick. And finally, covering your coughs and sneezing with a tissue or sleeve, not your hands. And should anybody avoid being in public or taking other precautions? So we just want to emphasize that if you're not sick, you should go about your daily life. At this time, you do not need to limit any travel within the city or change anything about where you get food or how you prepare it, or avoid public gatherings or public transportation. You should only wear a mask if you are healthy. You should not, wear a mask if you are healthy. Face masks are only recommended if directed by a healthcare provider. So a few novel corona resources. The New York City Health Department website at nyc.gov/health.coronavirus gives up-to-date information about the novel coronavirus, including any updates on number of suspected cases, positive cases, all that kind of stuff, as well as the CDC website at cdc.gov/coronavirus. You can also call 311 with questions and say coronavirus to be directed accordingly. And just want to say thank you and see if anyone has any questions.
Thank you so much, Prachee, for your presentation and for really providing kind of an inside glimpse as to what the Department of Health does specifically in these emergency situations. So we did have a few questions come in, so I'm going to go ahead and jump right in with our first question. So someone asked, what happens internally in the department when there is a suspected case?
Right, so medical providers throughout the city contact the health department when they think they have a patient that meets the case criteria for testing, and that case criteria is set by CDC. And if all other causes have been ruled out, so if they've tested for influenza and they're negative for any other kinds of respiratory illnesses, then we may suspect that this person has coronavirus. After consultation with the health department, if the decision is made to test the patient, specimens are taken and delivered to the New York City Public Health Lab and transported to the CDC for testing. So currently, CDC is the only entity that can do the testing. They're working on getting testing kits and equipment to local and state labs do the testing, but we don't have that capacity just yet. So to date, we've received many calls regarding suspected cases. The criteria includes things like travel history as well as certain symptoms we're looking out for. But so far, only seven people have met the criteria for testing by CDC, and all 7 of those were negative for novel coronavirus.
Okay, great. And I know that all the suspected cases so far, the tests have come back negative. But in the future, if a test were to come back positive, what would be the next steps? Like, what would be the immediate actions that the Department of Health would take in an instance like that?
Right, that's a great question. So there would be the appropriate clinical management for the actual person who has novel coronavirus, depending on their symptoms. We want to make sure the person is being taken care of for however symptoms they have. In addition, all close contacts, including the healthcare workers, would be identified by the health department's disease detectives, and the appropriate level of monitoring for those contacts would be initiated.
Okay, great. And then someone asked, there's a lot of talk in the news about whether or not this is going to be labeled a pandemic. Who is it that actually makes that call of when or if the coronavirus reaches pandemic status?
Ooh, that's a really great question. I know there's a lot going on in the news about that. So there are various definitions of the word pandemic, from the CDC and WHO. Here in New York City, we're carefully monitoring the situation globally and across the country, and we're in close contact with our colleagues at the CDC and other cities. So if we get to that point, the calling in something a pandemic will be done in consultation with many players. It's not just this, the New York City alone wouldn't necessarily call something a pandemic.
Okay, great. And then we have a question here about people who English isn't necessarily their first language. What are we doing to reach those people who may speak different languages?
That's also a really great question. Yeah, so that is one of the challenges we face in this particular response. It is a City Hall priority. We've been working very closely with the Mayor's Office on Immigrant Affairs, MOIA, to make sure that we are being culturally and linguistically competent in all of the things that we are doing. So whenever we have staff interacting with potential suspect cases or, for example, if somebody needs to be in quarantine, we're making sure that we have health department staff that speak the language and are able, and we also have translation services and language lines. So there's multi-pronged approach to making sure we're able to effectively and communicate with anybody whose first language is not English.
Great, that's really good to hear. And then I think we have time for one more question. And I'm not sure, Prachee, if you're going to have an answer readily available for this, but someone was asking about a previous coronavirus. How was the spread of SARS stopped in New York City?
I don't actually know the answer to that one.
Okay.
I didn't work at the health department back then, so I wasn't part of that response. So
Yeah.
I can try to find out and send over an answer to that.
Okay, great. So we can follow up on that one. So I think that's all the time we have for questions today, but we are going to be sending a survey out following this call. So if there are any questions that you're burning to ask, didn't get to today, you can feel free to put that question in the survey and we'll do our best to get an answer to you. But for the last few minutes we have of the call, I'm going to hand it back over to Sarah to share a little bit more about the fund and what you can do to keep in touch with us.
Great. And Prachee, thanks so much for such an informative presentation. All of us, I know, we really appreciate the work you and your team do every day to keep us healthy and safe. But before we end, I would like to say a few more words about the fund and our unique partnership with the New York City Health Department. Since our inception now over 18 years ago, we've secured over $400 million in grants to support a wide array of innovative programs and pilots. Our work is done in close partnership with the health department to develop new approaches and then secure the funding. And then we expedite implementation. And as an example, last year alone, we secured over $19 million to support 22 different programs that are currently being executed. And examples are a grant to provide enhanced linkage to care for Hep C patients by testing a text messaging system, a pharmacy to farm program to increase vegetable and fruit consumption among low-income New Yorkers, and a program to increase access to sexual and reproductive health care for at-risk youth. Here at the Fund, we really believe it's important for all New Yorkers to have direct access to public health experts and information. Through these public health talks, we really hope to foster a deeper understanding of the work that's being done, but also that hopefully you will become advocates for this amazing efforts that are happening on your behalf. As Nicole said, as a follow-up to this call, we'll be sending a brief survey. We want your input so we can continually improve the information and types of information we provide on the call. You also can feel free to get in touch with us. I hope you do. Follow us on social media, subscribe to our newsletter, and just to stay up to date. And lastly, thanks to all of you for taking 30 minutes out of your lunchtime to join us today. Stay healthy.